I put friends in quotes here, are referring back to an old conversation of yours having to do with the cost of expanding the healthcare system. Let me play it and get your reaction on the other side.
You want to guarantee that all people have access to healthcare as you do in Canada. But I think what we understand is that unless we change the funding system and the control mechanisms in this country to do that, for example, if we expanded Medicaid to everybody, right, give everybody a Medicaid card, we would be spending such an astronomical sum of money that, we would bankrupt the nation.
Obviously, Senator, the issue of this is there's the idea of health care for all is something that has majority support. And then when you remind people how much it could cost, how much taxes go up, then people get concerned, and obviously you were concerned about the finances there. Explain what you mean and how you can change the funding system to not make this so astronomical.
Okay, very good question, Chuck. But here is my hope. You and I are going to discuss this within 5 minutes. I would hope very much that NBC and CBS and ABC allow us some serious discussion time to explain to people in our country why we are spending so much more than other countries. But very briefly, and I would hope that we can have an hour discussion at some point on this issue. Very briefly, this is what we're going to do. Number one, private insurance companies in this country spend between 12 and 18% on administration costs, and they're administering hundreds of different private insurance plans. You have a deductible of $5,000, I have one of $8,000. It is incredibly complicated and very costly to administer. The cost of administering the Medicare program, a very popular program that works well for our seniors, is 2%. We can save approximately $500 billion a year just in administration costs. Okay. Second of all, because we pay so much more per capita on health for our prescription drugs, by having Medicare negotiate drug prices, we can save over $100 billion there. So that's a lot of savings. Thirdly, and here is the important point, my Republican friends say, well, Bernie wants to raise your taxes. They forget to conveniently mention that Bernie wants to do away with the private insurance premiums that you're now paying. For example, Chuck, the average employer who has a worker who makes $50,000 a year is spending $13,000 a year on health insurance for that worker. The worker himself or herself is spending $5,000, $18,000. Now, if our plan goes into effect, that $13,000 private insurance premium disappears for the employer. It goes down. The amount of money that the worker is now spending, that $5,000, goes down. We replace private insurance premiums with Medicare premiums. The average middle-class worker saves money.
Well,